Koshiro, and I am here to summarize or conclude their section, which says that the Nigerian government should prioritize funding tuberculosis over funding HIV with my first point. But before I proceed, I overheard my debunking debater make mention of the government should prioritize funding HIV drugs because there are prostitutes on the streets who want to knack in the name, who want to knack. Please, the government should not prioritize it because the more the drugs being funded into Nigeria, the more the knacking increases. my point proper. In Nigeria, she also makes mention of Nigeria having one of the highest population in Africa. Nigeria has one of the highest population. You testified of it, right? So this is telling you that tuberculosis is an airborne disease in which almost all the populations in Nigeria can get it easily because Nigeria is a developing country and not a developed country. So with this, you find out that there is overcrowding. In Lagos, we have thousands of people there who are carrying out ashawo business. And you find out that with that, when the government fund that drugs, the ashawo business will not only be in Lagos. It will come to Taraba, we will go to Abuja. From there, we can even change the Nigeria name from Nigeria to Nakin State, you understand? So with this, you find out that the government should prioritize funding tuberculosis because once the government prioritizes funding tuberculosis, you find out that it also creates room for the HIV patient not to have the tuberculosis. But if they fund HIV, you find out that if they fund HIV drugs, you find out that the TB is there, and you know that HIV is not curable. So once they get the HIV, automatically they are getting TB, of course. But if they fund TB, find out that the HIV patients will get maybe other infections, but not tuberculosis. This is going to reduce infection or co-infection. And you also find out that TB is also the government should prioritize funding because it's a potential for elimination. We can eliminate TB in Nigeria, but we cannot eliminate HIV in Nigeria. I hope with this I've been able to brainfool and not to brainwash you, to clarify the unclarified down to you, to make you see reasons beyond reasonable doubt that the government should prioritize funding tuberculosis over funding HIV in Nigeria. I raise my hand.